Hey everybody, welcome to my channel. I'm Dr. Perkins, a board certified OBGYN, and today we're talking about what age is considered a high-risk pregnancy. In today's episode, we will talk about the age that is considered to be high risk in pregnancy, complications of high-risk pregnancies, getting pregnant after the age of 35, and things that you can do to ensure that you'll have a healthy pregnancy if you are high risk secondary to your age. Being pregnant within a certain age range can really increase the amount of complications that you can have in your pregnancy, during labor, and postpartum. Advanced maternal age, or AMA, is the newest entitlement for the female over the age of 35 in pregnancy. Now, we've been called geriatric, we've been called elderly, and now we're just advanced the maternal age. And so I think it's a better way to kind of classify us. And I say us because I'm falling within that range as well. And so these are the terminologies that are given to people over the age of 35 because of the increased risks. And so we know this risk starts as early as the egg that essentially has been with you since day one of life. And so by the time that you get to the age of 35, your eggs are 35 years old as well. And if you're 40, your eggs are 40. If you're 45, your eggs are 45 years old. They've been around for quite some time. And so because of that, the quality and their function actually decreases over time, increasing the likelihood of having chromosomal issues and other problems in the developing baby. But listen, there's actually more as far as the age that is considered to be high risk. Did you know that pregnancies under the age of 19 is also considered to be high risk? It absolutely is. You don't hear about it much because we focus so much on 35 and up, but pregnancies under the age of 19 have also been shown to have an increased likelihood of having complications, and we're going to go through that. Some of these associated risks include postpartum hemorrhage, meaning that within the first 24 hours after delivering your baby, you're at increased risk of having heavy vaginal bleeding or bleeding through a C-section if necessary, more than a liter of blood loss. It also covers late postpartum hemorrhage. It means hemorrhaging outside of the first 24 hours after delivering your baby. There is increased risk of having eclampsia. Eclampsia is one of the hypertensive disorders of pregnancy, wherein you have elevated blood pressures, but those elevated blood pressures have also now begun to affect the organs internally, meaning that your kidneys may not be functioning well, your liver may not function well, your heart, and others as well. In the instance of having preeclampsia, meaning you're having these dysfunctions in your organs, you may have a progression of this disease process leading to you having seizures and strokes. Once these types of events begin to happen, you are now in the state considered eclampsia. It's a very dangerous place to be. It is really life-threatening, and you want to stay out of that zone. And so we know the likelihood of this happening is increased when you're greater than 35 and under the age of 19. Preterm birth is another complication of high-risk ages. Preterm birth means that you deliver a child before 37 weeks of gestation. Poor fetal growth or low birth weight is also another possible complication of high-risk pregnancies due to age. This means that baby may have a growth restriction where it doesn't grow as fast and as well as the average baby would. It also means that at birth confirmed, baby's weight may be on the lower side. Lastly, there may be an increased risk of having neonatal mortality. That means that, unfortunately, we see an increase in fetal or neonatal deaths in these populations as well. So now, is it really harder to get pregnant after the age of 35? It actually is. We know that as the egg and the sperm comes together and we try to exchange all that genetic and chromosomal information, that when you have a lower quality egg, it makes it so much more difficult for that transaction to happen the way it should. And so because of that, it takes a little bit more time and effort and sometimes a little bit of assistance to help to achieve pregnancy when you're older than 35 years old. The good news is when you're over the age of 35 and you do conceive, we have additional wonderful testing that can check to see if the developing embryo is normal and whether or not any additional testing or interventions need to be done. Some of those tests include a blood test called cell-free DNA or non-invasive prenatal testing, NIPT. Both names really represent the same test in which we are looking at the fetal DNA in a female's blood. And this test can be done as early as 11 weeks of pregnancy. And it's such a wonderful test in that when you examine the DNA of this growing fetus, it will tell you all the details about whether or not the chromosomes are normal, are there any missing links or any parts that just didn't transfer well, and the growth can be impacted by it. And so it's such a wonderful test to take, and compared to all the other genetic non-invasive tests, this is the best one on the market right now, and you can be reassured if it returns low risk that the growing fetus is, as far as that point in pregnancy, quite normal. If that test happens to return with some degree of abnormalities, then the next level of testing would be much more invasive. This may incorporate a chorionic villus sampling or amniocentesis. And with these, you have confirmation because you are actually selecting DNA from the surrounding fluid or placenta from around baby. This incorporates needles going into the abdominal wall and get into the space where baby's living to get DNA coming directly off of your baby's body. These all together will let you know how normal the growing pregnancy is at that time. If you are over the age of 35 and you're trying to conceive, and maybe you're struggling or you're just concerned about what your risk factors are, here are a few things that you can do to increase the likelihood of having a normal pregnancy. It is always recommended that before you actually attempt pregnancy, that you schedule a consult with your provider, your OBGYN, one that hopefully handles high-risk pregnancies, and complete a preconception counseling session. Essentially, that is a session that explores and examines your history, your partner's history, and it helps to organize your life, your body, your future by identifying any problems that you have, any comorbidities, meaning medical problems that may need to be optimized prior to pregnancy. And it also looks at possible testing that can be done before conception to be able to decrease the likelihood of having a problem when you do conceive. Now, while we can manage so many things in pregnancy, many times when you optimize the function of your body, if you have a comorbidity like diabetes or hypertension, that you manage those well and that your body is in a state of homeostasis. This helps for conception to work, for a growing pregnancy to implant itself well in your uterus, and for it to continue to thrive and grow as it should throughout the entire 40 weeks of pregnancy. And so the preconception session will identify these problems and help you to put plans in place that will ensure that your pregnancy is one that is stable and well. The next recommendation would be to optimize any underlying medical conditions that you have. As I just mentioned, if you have hypertension, be sure to have it in control. Be sure that your blood pressures are normal. If you have a thyroid disorder, just the same. Be sure that you're taking the right dose of medication. Be sure that your levels are within the range that it should be. If you're diabetic, be sure that your diabetes is under control. And the same concept applies to all the other medical problems that could be potentially present in your system. We want to be our best selves prior to entering into fertility or conception so that your body isn't under additional stress when the focus should be on the growing fetus. Next, I recommend taking a daily prenatal vitamin with an adequate amount of folic acid. In general, if you have no other risk factors, taking the average folic acid would be, which is 0.4 micrograms, or you can have 1 milligram of folic acid on a daily basis. If you do have other high-risk issues or any history of having nuchal translucency problems, then you may need to take 4 milligrams of folic acid per day. Your provider will guide you on as far as which dose will be best for you. Next, I recommend not smoking, drinking, or using any types of drugs. These can just add to the possible complications, and when you're in this high-risk state, the last thing that you'd want to do is to achieve pregnancy and lose the pregnancy for some reason, and drugs can help to do that. Lastly, I like to recommend reducing stress. kind of hard. I think we're all stressed at some point, but the stress that's a dangerous type of stress is one that is chronic. Acute stress is completely okay. Those are stressors that they happen and you're able to solve them and get rid of them within a relatively short time, a day, a few days, a few hours, a few minutes. But if you have chronic stress, things that are causing your cortisol levels to be elevated over a long period of time, weeks, months, years even, these can be really dangerous to a developing embryo, fetus, and baby. Listen, being balanced is so important that I would like to offer you today a free copy of my ebook, Hormones Don't Lie. In this ebook, we dive into the hormones of our female bodies and how to optimize them. To get your copy, click the link below and I'll be more than happy to send it to you. I'm Dr. Perkins, a board certified OBGYN, and it's my pleasure being here with you. See you next time.